And I got talking to Nick initially, and I said, "Well, what do you think? Should we start a discussion around this?" And then shortly after this, the university was dishing out a bit of cash, and I said, "Well, I'll have some of that, and we'll start this network." And Anthony joined us together with their destination national parks. They're called natural landscapes now. They used to be AOMBs. Transport providers in community rail, like that, and local authorities. So we've got sort of quite an eclectic group. And the idea, really, I mean, we are all the converted. We all believe in this stuff already, of course. And lots of my colleagues from the national parks, of course, and the AOMBs are trying to encourage people to access these protected areas by more sustainable means, by buses and trains and so on. And they're not having lots of luck, let's say. It was struck me again that the funding for any sort of intervention was 3 years. They could bid for it, they get 3 years worth of money. And when the money ran out, the intervention stopped and everyone back from the beginning again. And I thought, oh, come on, you know. It was driving me mad. And so this is what we're really about. We started, really, I was interested in developing a research agenda. And when we got together in our first workshop, it was pointed out we actually know quite a lot already. You know, lots of people have covered this ground and thought about these things. But for some reason, it's not having that impact. It's not happening on the ground. There's some reason, some barrier to it. And so that's really where our conversation is now. It's about sharing this good practice and what's going on. So we run regular bi-monthly meetings, all online these days, which suits me, because my hearing's appalling. And if I put headphones on, I can hear the world much better. But we've had sort of community bus. We've had Alistair Kirkbride, some may know. We've just gone a little jolly around Europe and had a look at how our European cousins have done it. We've also had a presentation from Richard, who's now left the Heart of Wales Land Walking Trail, looking at the different ways you can promote sustainable access. I mean, because again there are two parts to this. There's the to and from these places, and there's the travelling around these places. So it's you know, obviously there's an important driver in that we need to protect these landscapes, but we also need to sort of stop people turning up by car as well. I should say, dear colleagues, we're kind enough to provide me the notes for lots of these slides, which I've forgotten. So Richard's going to freewheel, which makes it more fun for me anyway. They may wish to disown me by the end of this presentation. So here's some stuff that put together, and it just shows that the level of visitation by car, New Forest said 90%. That comes from Angela's PhD, I think. And that's despite actually having really good rail links and some really excellent bus services. In fact, we had a presentation. If you ever get a chance to talk to, and then come back to me again, with age, and some really good buses running around the national park, linking up, encouraging visitors. And they're really expensive. 15, 20 quid a day. It's quite pricey, but they sell it as part of the experience. It's not travel to and from. It's about going out and enjoying the restaurant and not driving. So you can, like I do even when I'm driving, look out of the window and point at stuff and not concentrate. Yeah, and that's perhaps not certified because it's much harder to get there just by running. But that's the Brecon Beacons, isn't it? Yeah, and chasing my head and struggling. Despite living in Wales for 5 years, I've really struggled to pronounce it for start. But you can see the scale of it. Tim Nicholson, Peak District, he has the biggest, most of his visitors. something like this, a day visitors, and they're all driving from Manchester and Sheffield, and they're all within a stone's throw. So he has real issues with this stuff. So it is a real issue. Yeah, and I think pretty much as has been said here, that just cars are part of our lives now, aren't they? I mean, I always thought, you know, people saying, well, we need to get people out of the cars. And I thought, well, actually, it's taken us 50, 60, 70 years to get here into this car society. It's going to take some time to unwind. I know we need to do it quickly, but it's just become embedded in what we do, you know. My dear wife, when I first met her, she would jump in the car to go 500 yards to the shops. And I said, really, and I wasn't quite so committed to the course as I am now. But I thought, well, by the time you found the keys, got in the car, driven up the road, parked it, got out, gone to the shop, and done it all in reverse, I'm there and back and enjoying my biscuits with my cup of tea. You know, just because it's so ingrained, I think that's the problem. And it's then how you shift people. I'm not going to read all these. You can do that bit. I love reading it. Saying I go really off piece sometimes. Yeah. So of course it then causes some real problems. I do remember some years ago that my year when I went walkabout, I went to the Lake District for a few weeks with my tent on my back. And I was amazed. I think it was the road between Bowness and Ambleside. And as I walked along, these cars would sort of shuffle up, and then I would walk past them, and then help past me, and then I would walk past them because they were moving. I thought, I'm really enjoying this, guys, because you know I'm feeling more of it than you are. It's just crazy. So there are all these impacts, and actually, when you think we're going to these natural landscapes, to enjoy them, to relax, get the health benefits, mental, physical health benefits, and yet we're spending most of the time sitting in the car. And it just makes you wonder why people can't see that. And I think, you know, my colleagues here have already covered a lot of that ground. Because it just, to me, it seems crazy. And it is there's a Welsh example, of course. They have had some success, I believe, in getting people out of their cars here. And Alistair, who did a presentation last week, said it's been well received. But I think they put in other things, buses and stuff, which then enables people to make that change. So I think, and you know, I'm trying to remember the guys, it was an academic I was taught up, economist for my sins. If you want to change two things, you have to have two tools, as it were, and it's that sort of thing. They've not just said you can't park there; they've done something else as well. So you have to make an alternative available. It's I recognise this from Angela, and she's right. We've got to do something about car ownership. I mean, there are small changes now. If you look at the National Travel Survey. And things, the number of youngsters with driving licences is falling, has been falling, and there are probably lots of external reasons for that. The cost of buying cars. I was amazed. The Malaysian sellers and the price of them now. I just look at them. Who would buy one of those? It's cost so much, but yeah, insuring and etc. I think particularly youngsters within the cities. Just so easy. If you're going to go out with your friends, get on the bus or the tube, perhaps the and maybe we should pick up on that. Maybe that's somewhere we need to look at. But it's a political hot potato, and I think this has already policy. My hearing so bad, I only picked up on part of the conversation. But I think it becomes not necessarily a football. And if you want a few more votes, well, let's go with the car guys. They're always good for a few votes. So let's have a go at LTNs and stuff like that. And so we're going to delay, you know, introducing electric cars, basically. Interestingly, on Facebook yesterday, day before, friend of mine from Bari in Italy posted something from Copenhagen Eyes. And it two pictures with this sort of motorway spaghetti junction on, one with petrol cars and one with the electric cars, and it looked exactly the same. So yeah, you know, it's yeah, but it's not just it's shifting away from car ownership, but it's shifting, you know, giving them something to shift to. I think especially if you think back just 3 years is in there almost COVID, we were able to change our behaviour really quickly, and people do like to get outside and out and about and do so. And people even would drive hundreds of miles to do it when they shouldn't. We've got to have an alternative. You can't just sort of stick roadblocks up. So sorry, you can't go. And yeah, so to sort of bring it back to health as well, really, a couple of things I just picked up while I was tidying up the presentation, so it fitted Richard a little bit more. Was this, you know, there's really good reasons why we should let people get out and about and get to the countryside. It does them good. They become more active, mentally resilient, better health, and I think they get perhaps to appreciate it more and might be more inclined to do something positive for it. Who knows? And we still see the odd idiot throwing something out the car window. But access to public transport has fallen over recent decades. I saw another report recently done by the University of Leeds, I think, for Friends of the Earth, looking at bus services in the UK in rural areas fallen by 52% in the last 15 years. So that's the problem we've got. It's a steep decline in the alternative, and we've got to obviously come up with that. One of the things that colleagues and I, Andrew and Nick particularly, are looking at, we're really inspired by. We'll go backwards. That's a bit for this bit. No, wrong way, Richard. So I'm not that good with these. It is the daffodil line. If you get a chance to look at their website, it's really great. It's a community bus. It was the lady that inspired this. Was fabulous. She doesn't drive, and Stagecoach are pulling her bus service. It links Ledbury with Newent, where she lives, to Ross and Wye, and she was right. And so she started banging the drum for this and get people together, and they started the service again, and it's even more successful. We've got double the number of passengers now that they had previously, because they really engaged with the community with it, which was great. I thought it was a brilliant example of wheel that inspired by a presentation, I have to say. And it's you know, it's great because they're big plants for the hop gardens. So I had a great time on the bus. It was just me. So what I want to do, because I'm sure I've talked for too long already, as I'm inclined to, we don't have the answers. We know what we should do, as I've said at the beginning. We understand that it's good for us to be more active, to drive less, that we pollute less, etc., etc. And we tell the public, but nothing happens. So that's my question to you. What do we do? Is it all on the politicians to introduce 20-mile-an-hour zones and say, well, it's, you know, it's got to change? And we had examples of demand management where they just said, well, you can't drive to the park unless you pre-book and get a ticket because we just won't let you in. Now that's still saying, to me, that's still saying cars are okay. That example was from the USA, so perhaps I shouldn't be surprised. But Alice also showed us a picture from Switzerland, and they were doing all sorts of stuff. It's really great. Loads of public transport, all linked up. One ticket gets you to do everything, plus the attractions, all sorts of stuff. And then there's this massive new car park just been built. And when I say massive, I mean massive. It was enormous. Thousands of cars in this. So they still drive even there. So nobody's got all the answers. What are the answers? How do we talk to people? How do we have that conversation? It is our question to you. Really.
Has anybody got an answer? Or has anybody got a question?
Yeah. Yeah. So I was just wondering. Yeah. So one thing I was wondering is. So yeah, Louis Prince, Newport City Council. Although I suppose my question is more broad. I was just wondering where we've got these destinations and say we want to put in, I don't know, say let's say it's a park and ride service to a major destination within a national park. We know that if we did that, it will improve air quality, it will improve the quality of the area, there'll be less noise from roads in the area and generally making it a nicer place. But from a funding perspective, is that going to be, say, all on the National Park Authority who might not have the funds to fund that? How do we go about doing those joint initiatives and those funding, and how do we get those messages across to fund, you know, to make sure that those initiatives that benefit lots of different, you know, government departments would make sense there, and we go about making that happen?
Yeah, I mean, it's interesting. I don't know whether we get Andrew and Nick up actually on my other screen now. I can see them patiently waiting. But very interesting. I mean, somebody me raised this point last week when we were talking to Alistair, and we've somehow got to uncouple ourselves from all that lovely car parking revenue. We were talking about the National Trust particularly, because we've got a colleague with trust in the group. We have, you know, car parks and car parking revenue has been used to pay for so much in the past, and it's if they stop people driving, there's going to be big holes in their budget. So not only, you know, the that right replaced, it's so it is an issue. It's just been, as Ian said, it becomes so ingrained in who we are, what we do, and it's how we uncouple that then to change that situation.
Quick question. I'm Gwenda from Cycling UK, used to be the Cyclist Touring Club, so I'm very but do you think part of the problem is with national parks themselves? We saw that in some ways it's like you're driving people to certain areas where enabling people to access the outdoors from their doorstep is a more equitable way. So maybe, I don't know, maybe we think we need to take the emphasis off these honeypot sort of things, because that causes problems with itself. And I think that's something to think about as well.
Yeah, I think, as I said, that there are two parts to the equation. There's the from home to the destination, and then there's the moving around the destination itself. And yeah, if you can get them to leave their car outside the national park, that's at least part of the problems, that use a bus or a bicycle to move around within it. I do wonder, actually, as we were having this conversation again last week, we went on actually double the time of the workshop. We just kept going and going. That whether we should build those parking lots next to railway stations or bus stations. So when people park their car, I think, well, actually, I could have come by train. You know, and it's planting without telling them, why didn't you? You just put the park and ride there, and they think, oh, cool, yeah, I could have done that. And then I've got this bike, and that's drawing the whole thing up for me. So some years ago, I did a European project actually with colleagues from across Europe, and I was asked to do some stuff. It was about encouraging people to cycle to World Heritage Sites, but it applies to everywhere, really. I think the first step is just to make it easy for people. And I took two examples when I wrote this guide. One was Llangollen, and we used to have a campus there, and I always used to go by train because I could get on my bike and just cycle down to Trevor, jump on the towpath, which was all service up to it, and it was brilliant. It was flat, you could enjoy the sunshine and the mountains and the river, and it was just great. Yet if you went on the website, it was, here's where all the car parks are. There was no mention of the Wadham, which is just a few miles up the road. And it actually, right at the bottom, it was, and you can cycle if you really want to, sort of saying. And I thought, you know, really, guys, it should be the other way up. If you look at the Eden, well, there they are, Angela and Nick.
I think Angela wants to say something.
If you look at the Eden, which is in a horrible hilly area, they actually do all sorts of things to try and get you to cycle. They'll recharge your electric bike battery, you know, and they'll let you in a bit cheaper. And then it was the first on their menu of how to get here. So it was just that, just make it easy for people really to get places rather than, you know, saying, well, I just assume that they're going to come in the car and put that first, you know, put it in the bottom somewhere. Sorry, energy.
Angela, if you come off mute, I think you can contribute now.
Cool. It's a bit disconcerting seeing my giant head up there, but okay. No, I just wanted to emphasize, probably going back to one of the initial question, is the way that we kind of bring about change in funding. I think what's not recognised in policy is the sheer scale of this issue. I think Richard kind of did have on his slide about kind of the proportion of driving has been going up for leisure travel, but more miles are travelled for leisure and the distance. And also in terms of, I mean, just an example, the Lake District National Park, from Alistair's presentation last week, he's shown, the scale of the travel to these destinations is a massive part of the carbon footprint, and it's going up, it's not going down. And I suppose my bugbear here is yeah, we can keep tinkering around the edges, but nothing is going to change because fundamentally car ownership's going up. Car licenses are going up. I know, again, Richard mentioned younger people, but I think also that study found that younger people are just delaying getting a license for various reasons. It's not that they're not going to get a license, it's an ongoing trend up and up. So our daily lives are kind of overlapping, and that, people are owning these cars, but a big part of their ownership is related to leisure travel, and a lot of that is travel to countryside destinations. So there's those local impacts, but the climate impact is huge, but it doesn't come out in policy. So even in the latest sort of, I can't remember what the rural plan is called, well, we contributed to that, but national parks and areas of outstanding national beauty barely get a look in. I think there's about one sentence in there about tourism, and yet it's the biggest impact. So it's more of a rant rather than a clear answer to a question, but it's just, yeah, if we don't recognise the scale, and a government doesn't recognise the scale, and also they don't fund, and also funding is sort of separate for national parks, as Richard mentioned, then how can we move on from that?
Thank you, Angela. There's just a quick comment in the chat saying about the National Trust or Wildlife Trust are considering care and how to bring that into encouraging people to travel more sustainably, thinking about how their trips might be affecting nature and how we can improve nature through our travel. I think we're going to have to move on now to the next presentation. Thank you very much, Richard. So next we have a presentation that will be shared through a pre-record, and this is by Michelle Symes, who's from Health and Rural Healthcare Wales, and this is about their Wellbeing Walks initiative.
Rural Healthcare Wales. My name is Michelle Symes, and I joined the Rural Healthcare Wales in November 22. and began working on the Wellbeing Walks initiative in December of that year, building on work already started during 2021. The initiative began with a request from the Green Aberystwyth Group during lockdown to instigate an initiative aimed at promoting, protecting and raising awareness of the importance of green spaces and outdoor activities on health, nature, the environment and well-being. A series of discussions followed with various stakeholders, including Carradine County Council and other providers of walking initiatives in the region, were consulted and supported the project, such as West Wales Walking for Wellbeing Project and Carradine County Council's Coast and Countryside Walking Routes. Momentum built from July 2021 when Rural Health and Care Wales were asked to take the lead on the initiative, and today's presentation is a culmination of the 2-year investment by Rural Health and Care Wales and partners. Routes from the proposed GP health and hospital starting sites were explored and funding was sought, with £2,000 received towards the design and production costs from Carradine Association of Voluntary Organisations CAVA in September 2021. The intention of this presentation is to take on a simultaneous journey of the Wellbeing Walks initiative and my daily journey into work, to emphasise the importance, availability and accessibility of green walking spaces on physical and mental health and well-being. The presentation includes deliberate pauses during which time stills photos of natural environment on her walk to work will show, and Whitesay's video or sound clips from nature will run to engage in rural health and care awarenesses in my journey. So let's get started in the car. The initiative responds to many of the national strategic aims of the Welsh Government, NHS Wales and Public Health Wales, and their regional and mid-Wales specific priorities, as well as meeting green aggressive groups' initial aim of promoting and protecting green spaces within aggressive town centre. The initiative aligns with the Welsh Government A Healthier Wales and Plan for Health and Social Care 2018, the Wellbeing of Future Generations Wales Act 2015, Mid Wales Joint Committee Strategic Priorities identified in the Rural Health and Care Wales Work Programme 2024-23-24, Aim 1, Health, Wellbeing and Prevention. The initiative also falls within the Welsh Government's Green Agenda, Clean Air Plan for Wales, Healthy Air, Healthy Wales, and Health our University Health Goals, A Healthier Mid and West Wales, Our Future Generations Living Well 2023. Rural Health and Care Wales had three aims within this initiative: to highlight the health and wellbeing benefits of walking in nature, to provide an accessible activity for healthcare professionals, patients and visitors, to enable groups of people to engage with wellbeing and walking in nature activities, to promote the appreciation of nature. To do this, Rural Health and Care Wales has undertaken both a national and an international research review of the benefits of walking in nature on all aspects of health and wellbeing, and on the importance of green spaces with an accessible reach on community, self-esteem and self-reported health status. Findings from this review are being drawn up as part of the Wellbeing Walks Initiative report, which we hope to have in draft format by the end of December. Research has proven that walking has a positive impact on specific mental health, physical health and well-being. Specific mental health benefits actively promoted by health organisations include reduction in stress and anxiety levels, improved concentration, increased creativity as a treatment for depression, and improvement of sleep patterns. Specific health benefits promoted include protection against cardiovascular disease, stroke and hypertension, preventing falls and keeping muscles and bones healthy, assisting with long-term care of conditions such as arthritis, building stamina, improving energy levels and weight management, assisting in long-term care of respiratory conditions including asthma and compulsory obstructive pulmonary disease, reducing the risk of dementia and improving memory, decreasing the risk of type 2 diabetes and some cancers, and easing of menopause symptoms. Undertaking any activity, including walking for social health at any stage, is important for a range of health and wellbeing benefits, and it also encourages and fosters trust and confidence among communities and helps to combat loneliness and isolation. Leyden, 2003, stated, spontaneous bumping into neighbours, brief, seemingly trivial conversations or just waving hello can help to encourage a sense of trust and a sense of connection between people and the places they live. Regal 2021 stated there are 5 additional ways to walk with purpose: for perspective, reflecting on nature and the universe; for connection, while you can walk alone, you don't have to, you can walk with friends or a group or just with your dog; for learning, while listening to a podcast or audiobook; for gratitude, focusing on the positives of being able to walk; for productivity, walk and talk meetings, dictate networking or brainstorming ideas. Walking is also considered an accessible activity across all protected characteristics of the Equalities Act 2010, enabling widespread participation However, subtle elements of low-level support for people living with disabilities have been identified. Christie 2018 found that regular walking is achievable for most people without a disability, while Gennis et al. 2021 found that, compared with the general population, far less high-quality research has been done on the health benefits of physical activity for people living with disabilities. The physical activity epidemiological evidence base for people living with disabilities tends to be siloed within medicalised conditions, and most disability-related research has focused on improving function rather than health. The official launch of the Aberystwyth Wellbeing Walks was conducted by the Mayor of Aberystwyth on the 8th of December 2021 at Aberystwyth University's Healthcare Education Centre, located alongside Pattern Surgery, with a subsequent press release appearing on the 6th of January 22 in the Cambrian News. Significant public engagement was undertaken prior to and during the launch of the Aberystwyth Wellbeing Walks in December 2021 and with press coverage and via social media. Distribution of the Wellbeing Walk leaflets in Aberystwyth has taken place across 16 sites, including Broadgate Hospital Outpatients Department, Church, Pattern and Smith Surgery, Town Library and the National Library of Wales, Welsh Government offices and the Tourist Information Centre. The Wellbeing Walk leaflets were produced in conjunction with local designers and printers and have a distinctive styling aimed at being eye-catching and familiar. Further analysis of the impact of the initiative is currently being undertaken through analysing collated leaflet take-up data, social media promotion, responses and engagement with other agencies with an interest in wellbeing and the green agenda. Assessing the impact of the initiative on participants through direct engagement with users via online and manual surveys. Specific feedback is being sought on the impact of encouraging people to walk more outdoors and the increasing recognition of the health and wellbeing impact of spending time in nature. Work is also being undertaken to assess the effectiveness of the leaflets produced. The map shown here is an example of the styling of the routed walks, and the layout is the same for all of the series. Wellbeing Walks, the concept leaflet was developed by Rural Health and Care Wales and partners, including Coed Clare, and was launched at Rover Community Hospital in Machynlleth on 27th October 2023 by Machynlleth's Town Mayor, Councillor Jeremy Page. The Machynlleth Wellbeing Walk leaflets are currently available on 5 sites in Machynlleth, including Blass, Marmor and Rover Community Hospital. Whilst design plans and routes have not yet been determined for the Town Wellbeing Walk, progress has been made on the initial stages of development and contacts have been sourced for assistance. As you can see from the slide, Royal Health and Care Wales has covered a lot of ground in disseminating the health messaging contained within the wellbeing leaflets and promoting our three fundamental aims with this initiative: to highlight the health and wellbeing benefits of walking in nature, to provide an accessible activity for healthcare professionals, patients and visitors, and to enable groups of people to engage with wellbeing and walking in nature. Literally, I've walked the length of Aberystwyth several times delivering leaflets and posters, engaging in discussion with people around the promotion of and engagement with the leaflets and the mapped routes. Currently, we are actively seeking feedback on the health messaging, impact and take-up of the leaflets. Comments received to date include very informative leaflet. We will have as many of these leaflets as you can give us. We keep running out. Nice layout, useful discussion with clients, and for balance, islands in car parks not helpful, as we should not be advising people to park at sites to go walking, especially at the hospital. It just remains for me to say thank you for coming on this journey with me, and I hope that you found it of interest. If you are in Aberystwyth or Bingham and you take up the opportunity to do one of the walks, we'd appreciate your feedback. All of the details are on the current slide showing of how to get in touch with myself and Royal Health and Care Wales. Thank you.
Thank you, Michelle. Are you online there at all to take questions?
Yes, I am.
Hi, thank you. We got any questions from in the room? I have a question myself. So recently, it's not recent, I've always been walking actually, but I recently moved to an area where I found a lot of the footpaths are being quite degraded. So at one point there was a lot of funding that went into establishing some routes, making some leaflets like your organisation has been doing, all really positive things. 5 years later, the styles have fallen down, the trees are down, and you get there and it's like what Judith was saying, you find the environment is working against you. And going back to what Gwenda's comment was about bringing people to the local area, how do we kind of encourage people to value their local area? And have you had any challenges working with stakeholders in terms of figuring out the infrastructure on the ground?
We've had a few incidents where people have reported trees down, for example, and so we've had a similar thing. We've had to try and find somebody who would take responsibility for that. But I mean, really, the essence of our involvement is around the messaging contained around the health benefits. We engage with Ceredigion County Council primarily. They have a team of people who work looking after the coastal paths, looking after internal town walks, but the funding is obviously a significant issue.
Okay, thank you, Michelle. Any further questions? We're about on time now to move to our next presentation anyway. Thank you very much, Michelle. Emma Bingham, if I can invite you up. Emma is from the Community Transport Association in Wales. She's going to present to us about the bus buddies scheme and the learnings that they've taken away from that and then put more widely into the community transport across Wales.
Beth Cox, I've spoken out with a microphone.
You don't have slides, do you?
No,
We don't have any slides, yes.
no. I wish I had though. I was very brusque with my reply to Amy last week when she said, "Have we got slides?" I'm like, No. So yeah, my name's Emma and I'm one of the development officers for the Community Transport Association. The Community Transport Association provides an array of transport solutions in Wales, minibuses, dial-a-rides, flexi, community car, volunteer-led car schemes. Our operators provide inclusive and supportive and affordable transport for those who are at most risk of being outside the transport network. They cannot have other transport options. They lessen isolation and loneliness and keep people connected to their communities, which is really important. It's about health, it's about well-being, it's about doing all the things that you and I take for granted when we have good transport links. We have 100 members in Wales, and we've recently done some mapping, and last year there were over, I think it's a conservative estimate, but over 750,000 community transport journeys in Wales alone. Okay. So what do you do when you see people not accessing the transport network? And that's not just community transport, that's the public network, that's the buses and the trains, that's the cycle route, all those things. This may be because you have health issues, you may have anxiety and depression, maybe age, maybe simply you've never used public transport before. You don't know how to navigate bookings, you don't know where to get on, you don't know where to get off, you don't know how to use the app. Think about now if you had never got on a bus and I said to you, walk out the front door and I want you to take the bus to the station. Daunting, really daunting. So how do you solve this? Well, one of our members, PACTO, Pembrokeshire Association of Community Transport, Bingham, who is part of PACTO, is with us today. They decided they'd create a service. So they saw people not accessing any form of transport and they thought, right, we'll create a service. And it was called Bus Buddies. No, that's simple, what it was, a buddy for the bus. So it started in 2016. And in the course of its lifetime, it supported 10,000 journeys in Pembrokeshire. And they did this with volunteers, as volunteer-led. They went into people's homes. They sat with them. They asked them, where do you want to go? How do you want to get there? How can we support you to make that journey? Who would you normally travel with? They planned with them the right transport that met their needs. A lot of it was public transport, but this also began to involve community transport like dial-a-rides and the community car services that we have in Pembrokeshire. But they didn't just leave them there. They didn't just do the little checklist and say, yeah, you got on the bus at 8:15. They went with them. And they went with them for as long as that person needed them to, until they were confident enough to make that journey alone. They didn't get off the bus with them and leave them. They would go and do their shopping with them. They would have a coffee with them. They would sit outside the doctors while they went in, sit in the leisure centre while they did their yoga class. Often they went and did things like yoga classes with them. These volunteers were passionate about supporting people to access their communities. They did this by providing a positive space around the conversations of transport. So people didn't feel that they were a burden. They were having to wait for somebody to take them somewhere. They didn't feel that they couldn't go somewhere because they just didn't know how to get off the bus. They didn't feel isolated. And it was a caring, proactive structure that enabled people to then become completely independent. And the benefit of this project was immediate. a difference to somebody who hasn't felt able to go anywhere because they haven't felt the confidence to do so, or they actually just do need someone to stand by them to get on the bus. They actually just need that physical presence of someone with them. It sounds such a simple thing, but for many people, it's a massive thing. So giving people the opportunity to navigate themselves with support, their transport options, gives them ownership of where they want to go and how they want to live. When you have no transport, you have access to nothing. And I'm not just talking about cars and buses, I'm also talking about bikes and all the other modes of transport that we look at. So, you don't have access to education or leisure. I go back to my son, he's 16. The insurance conversation is quite pertinent to us at the moment. About to turn 17. But he had never travelled on a bus other than a school bus, because we live very rurally and our nearest bus is 6 miles away. So for him then to start using Flexi was a big deal for him, because he'd never got on a bus on his own. He'd never navigated that. So when you look at, it's not just older people that we're talking about. It's not just people who we might consider have a disability. It's just people. It's you and it's me. That's what's really important. So it navigated a process that is found difficult, and it had the people at its centre, always. And that's what community transport does. It's really important. Our passengers are at the centre of everything we do. And one of the things that did change in people was those people that had to travel with a family member. And when you are reliant on others in that way, it can really affect your self-esteem. So to be able to give someone the ability to travel independently with somebody that they trusted, but also somebody that they could say to, I'm just going to pop in here, you can stay there for a minute. There was no agenda about this. It gave an independence and moved them towards journeys that they never expected they would make. Honestly, I think that was the most fantastic thing, is they thought they just wanted to go to Tesco's, but now actually they want to go to the pub. They wanted to get a takeaway. Actually, it went from journeys that they had this label of had to journeys of give me joy. I'm going to make this journey because it gives me joy, and I can do it with somebody who feels that joy with me, and then later I can do it alone. So the project ended in 2022 because, I hate to say it, the big word funding, and there is a legacy, because this project was so important, because it impacted so many avenues that we've discussed today: public transport, active travel, community transport, independence, isolation, all of those things. So it was decided that PACTO and CTA would begin the process of creating training. And that training would look at supporting communities, local authorities, care workers, doctors, anybody really that felt they would like to begin to understand how this process could work, how they could sit with someone that they know and begin to navigate this transport journey with them. And it fits into supporting people to access, we talk a lot about warm herbs and health and wellbeing settings. There's these buzzwords that kind of potter around when we go to conferences and meetings like this. But nobody ever actually says, well, how are we going to get them there? Really lovely. How are we going to get them there? And part of this training was having the conversations when these projects are thought through, that we can train those support workers, those community centre staff, to be able to understand how they could implement some sort of travel training, how they could encourage volunteers to do this within their communities, and create a network of travel champions. It's more than putting someone on a bus. that just says, are you happy where you sat, dear? It's not that. It's so much more than that conversation, because we have that with passenger travel assistance. So it's not going to be limited to any mode of transport. We will look at all modes of transport, including active travel, because older people, particularly, we've seen cargo bikes, and mums love cargo bikes, but often don't have the confidence to use them. So it will run along various modes of travel. Bus Buddies showed that we need to be innovative. One size doesn't fit all. It needs to be flexible, and we need to make sure that community is at the heart of those discussions. It's going to be exciting. It's going to build on the knowledge of the Pacto family, and Pacto is a family, and the skills and knowledge of CTA. And it's going to support everyone. And the most important thing is that we support people to have that conversation about what good travel looks like to them in the most supportive way possible. So I don't like putting time frames on things, and I particularly won't because Wyndham sat at the back, and if I say it's too early, it'll shout at me later. But I hope in 2024 that we will have a pilot ready for a group, a local authority or a health board to start trialling with us, so that we can have some understanding of how this might work for the future. So thank you very much for your time.
Quick question from
Yeah, just a quick one. Thank you so much for that. Sounds like a really excellent project. Is it just based in Pembrokeshire?
It was just based in Pembrokeshire, and there are various types of travel training.
Yeah.
The thing about Bus Buddies was that it was bespoke to the person who requested it.
Okay.
And that's what made it different. It wasn't like a Transport for Wales, we'll meet you at the station. It was going and actually understanding what that person required, and that may be a community transport option, or it may just be someone saying, you know, when you get off the bus, you have to press the bell. How do I know that that stops my stop? Does it say on the bus, this is X road? So it could be as simple, or it could be somebody who actually does require a lot more support.
Yeah, so my question was like, I asked that question because of demographics in Pembrokeshire might not be relatable to my question. How do you support people, or how could this project, I don't know what Pacto is, but how can this be replicated in areas where people don't speak English, for example? How can you support them? How representative are your members? Do people speak other languages other than shouting like in English? How then do you include intersectionality? Lots of questions around equality impact assessments. Is that taken into account when shaping these projects? But yeah, around really communication and how do you include people that don't speak English or have diverse issues, or like, newly diverse themselves. Yeah, it's really important. Like I know Pembrokeshire has a totally different demographic to Newtown, for example, where I live. Then can't be 20% not white, but it's important that, I don't know, even within your teams, how many other community languages people speak, to really include as many people as possible. Because for me, I can think of loads and loads and loads of people within my networks that could really benefit from something like this, but might not speak English or shadow right, which means they could excluded from that. Yeah, I was really learned.
No, I will answer your question because I think it's a really important one, and I think I'm not the only person today here that has really valued hearing your voice today. And I think it's really important that you have an absolutely valid point, I'm honest. However, the point of something like Bus Buddies is that it is community-led. So the training will be delivered to that community for them to train on as they see fit. Yeah, so it's effectively will be like a train the trainer. So I will train you, and you deliver that training in the language or the setting that is most appropriate for the people that need that service. You are right. Diversity is an issue, and I won't shy away from that. I don't think any of us in this room will. It's really important. CTA do a lot of work in Swansea with Community Transport Association that I'm with. We do a lot of work in Swansea with East and the African Community Centre, etc. But the whole, I think, around that diversity question and language, it is that we will deliver it to you. And then with the principles of what we believe is right for that training, you will take that forward into your communities and deliver it to the demographic that fits who needs it. And that might be, you know, young people between the age of 10 and 18, which is not something we saw in Pembrokeshire. It may be workers, you know, under 35 people travelling to work, not understanding how to do that journey. That's why this has to be flexible. And I certainly think I doubt, I should think I'm not the only one that would like to have a conversation with you afterwards, because I think you've raised very valid points.
Thank you, Emma.
Thank you.
And next we have, to conclude, Elly Foster, who is from Ceredigion Trust Users Group, and she's going to talk to us about a recent advocacy kind of community action day, which was looking at the issues with declining bus services in our area.
Thank you very much. We're actually called Ceredigion Bus Action, and there you are, the word is action. So my name is Elly Foster, and I've got a degree in social policy and administration, and I've just retired as a teacher of maths and science, but mainly I am a veteran bus campaigner. So I know I have to wear my glasses, sorry, to see what I'm doing here. Right, in 1989, we got rid of the family car. It was such a big, brave decision, but with the money, we managed to buy a bicycle for every member of the family. And we managed to travel, this is in Hampshire, on the train and walking and cycling. So in 2000, my husband and I, when the kids were grown up, we moved to Midwest Wales, and we made sure we bought a house on the bus route. Otherwise, we wouldn't be able to get out anywhere. So it wasn't long before we joined bus campaigners because of the problems that we were having. And as a result of that, in 2008, I wrote a report for Ceredigion Green Party called Ceredigion Better Buses for All. Because Ceredigion is very much a rural county that has hardly any trains. There's only a train from Aberystwyth out towards Machynlleth, and the rest, everything, public transport is done by bus. Anyway, as a result of that report, I managed to get a place on a public transport users committee, which was fantastic. And I learned lots about the regulation of buses and funding of buses and all the different bodies involved and the complications that that brings. Anyway, things got better. And then we had the pandemic. And what happened in the pandemic is that we were basically told not to use the bus, to stay away. And then suddenly our buses got cut. And then as passengers, we actually got the blame. That word blame again. We got the blame for not using the buses enough. So as a result, the buses got cut even more. So my hourly bus service went to a 2-hourly bus service. We lost our Sunday service. Some bus services went down from 4 buses a day in the slightly more rural parts of Ceredigion to 2 buses, and then to 1, and then to losing your Saturday bus, and so it went on. Anyway, bus campaigners got back together again because we were not going to take this without a fight. We started writing emails to all the powers that be, and more people joined in when they found out about this. I'm a member of a Facebook group called Bus Users and Drivers in Ceredigion and Carmarthenshire United. It's a real mouthful, but God, you learn everything there is to know about buses on there. Anyway, we weren't getting anywhere, getting very frustrated, so we decided to arrange a bus action day. And this is where Amy comes in, because I'd actually been to Aberystwyth to the launch of C-Tram, and that's where I met Amy, and so I joined the Think group. And I took part in training on co-production, which is when we decided, you know, this is a really good way to have this bus action day. And with Amy's help, we arranged to have the bus done in such a way so that every voice is equal. Anyway, how do you go about arranging such a day? First of all, we sent invitations, personal invitations to all our local councillors, to our MP, to the Senate members, to the Transport Department, to Bus Users Cymru, to all the bus operators, and then we had a load of posters printed, which we put up in every available bus stop, and we handed out about 500 leaflets. We hired a hall. We were very lucky that a very kind individual funded all of this. He basically was happy to underwrite the cost of hiring a hall and printing the leaflets. Otherwise, it probably wouldn't have got off the ground. Anyway, come the day, we had 4 volunteers who were willing to be facilitators, Amy and myself amongst it, and we decided to have 4 main discussion groups. Funding, very obvious one, alternatives to your regular bus service, image of bus use, not just you know, how our bus users perceived. And somebody earlier on said, I'll never be seen dead on a bike. Well, I've heard people say, I'll never be seen dead on the bus, because the image of the bus user is really that of the needy and the poor. Anyway, and the 4th one, when I was the facilitator, is how do we envisage the future in 5 years' time? What do you think we would like to see? And is franchising the answer? Because that's what our minister wants. So, okay, we started the day. Amy was busy putting posters up with the rules of co-production when loads of people turned up and we were overwhelmed. And at the end of the day, we ended up with 5 councillors, which is good. Our MP came. He never got into the hall because the bus passengers were just bombarding him with questions. We had 2 members of our Transport Department and a Bus Users Cymru. Those 3 turned up in a personal capacity. We had no Senate members, no minister, 1 bus operator, so that was good, and about 90 passengers. And those passengers came from the north of Ceredigion and Calbons to the south near Cardigan. They came from the west, Newquay and Aberystwyth, to the east and Lancashire, and everywhere in between. We also had a grievance wall so that people could really write down their frustrations and their anger and the loss of bus service, and they filled up 10 sheets of paper, you know, big flip chart paper. Anyway, at the end of that, we wrote a report, and I've got the report here, which is our Bus Action Day report, and it's available on the Think website. I've also got a couple of spare ones should you need one. We went to the media, of course, and they've been very supportive of us, especially our local newspaper, the Cymru News, which was mentioned earlier on. We've also set up meetings with the minister. That one hasn't taken place yet. He Waters has not been well, but we hope we are going to be able to do that in January. We've met with several Senate members. Amy and I met with Jane Dodds, who's the regional Senate member, last night, and last week I met with Ellen Jones, who is our Ceredigion Senate member. Ellen Jones is saying she's very supportive, and in our report we put quite a few recommendations, but our main one is that we want to have a strategic body, some sort of setup where passengers are going to be represented, where people are going to be feeling that they're going to be listened to at all times. One person at the Bus Action Day actually summed up the situation in Ceredigion when she said, what we currently have is a bits and bobs service. And we need to have far more integration. We need bus operators to be talking to each other. We need overall somebody to actually say, this is what we need, rather than this is what bus operators are willing to provide. So we've got a meeting set up on the 21st of December, where we're going to be discussing setting up this strategic body. And I spoke to our local councillor last week, Keith Henson, who is responsible for transport at Ceredigion, and he actually said to me, Elly, I'm really looking forward to this. I'm keen because we need to do something. And I really hope that that something means that we can all work together in order to resolve the problems that we have, because our buses are desperately needed to be back to full capacity. Thank you very much.
Thank you so much, Elly. I always appreciate your enthusiasm and your determination to keep going.